Welcome to The Explainer. Today, we're going to fundamentally shift how we understand and honestly how we treat physical pain. We're looking at a completely science-backed framework of 15 specific principles. It's an approach that zeroes in on the nervous system, sensory input, and our ultimate goal, restoring function without causing any additional threat to the body.
Okay, let's just dive right into this counterintuitive idea right out of the gate, because it completely reframes our entire approach to rehab. For decades, we've treated pain like it's the core issue, right? Like it's this villain we have to attack and destroy. But what if we've been looking at it completely backward?
Principle number 1 actually tells us that pain is just the brain's response to a perceived threat. It's an output, it's not the enemy. Think of it literally as your body's alarm system. So that means our goal here isn't to aggressively force a change or attack a painful area, but to actually communicate with the brain to dial down that perception of threat.
So we have a roadmap today that covers 15 specific principles designed to help the body heal. And the beauty of this framework is how it really shows us how to work with the nervous system instead of fighting against it. The whole shebang basically boils down to this: reduce threat, restore function, and improve lives.
Now, don't worry, we aren't going to just sit here and read off a list of 15 things. We're breaking this down into 6 easy steps: redefining the pain problem, the sensory skin highway, mechanics, scars, and history, why aggressive therapy fails, and finally, treating the whole system. Let's get into it.
Section 1. Redefining the pain problem. It's an output, not the enemy.
All right, so the absolutely crucial point to grasp is that pain does not always equal tissue damage. Sometimes the tissue is completely healed, but the alarm system is still blaring like a car alarm at 3 a.m. You know? The nervous system is always prioritizing safety above everything else. And this ties into a super interesting dynamic. Fast input to the nervous system actually equates to less threat, while slow, aggressive input makes the body guard up. For a treatment to be effective, it absolutely has to feel safe.
Moving on to Section 2, the sensory skin highway, focusing on skin and input.
It is wild to think about how specific receptors in our skin, our body's largest sensory organ, actually modulate pain. Merkel cells handle sustained pressure, Meissner corpuscles process light touch, Ruffini endings respond to stretch, and Pacinian corpuscles, they detect vibration. They're almost like your body's personal earthquake detectors. The big takeaway here is that overloading or compressing these receptors totally disrupts normal signaling. But if we improve skin mobility and decompress them, we actually reduce pain. And that sets up a brilliant scientific concept, the gate control theory. Think about the last time you bumped your elbow. You probably immediately started rubbing it, right? Well, why do we do that? Because non-painful input, like movement, touch, or even taping, can literally close the gate on pain. They use fast sensory fibers that race up to the brain and override the slower pain signals. It's absolutely crucial that treatments stimulate this kind of non-threatening input.
Section 3. Mechanics, alignment, and space. The physical reality.
Okay, mechanics absolutely matter. Alignment directly affects both pain and function. If a joint is misaligned or deviating, say something like ulnar drift, it mechanically increases stress and pain-related input. Proper positioning physically reduces that irritation, and the brain immediately interprets that as a drop in threat level. So alignment really has to be assessed early on. And because mechanics are so important, we have to realize that space in the system reduces threat. Compression increases pain signals because it's squeezing those dermal receptors we just talked about. So creating physical space, using tools like specific taping, wedges, or just proper positioning directly takes the pressure off. Creating that space allows for normal movement and normal signaling, which just calms the whole nervous system down.
Section 4. Scars, surgery, and history. Because, let's face it, the body remembers.
We absolutely have to talk about history. Scars restrict the skin and the underlying tissue, and adhesions create this really chaotic, abnormal signaling to the brain. On top of that, surgical history alters tissue layers and motor patterns entirely. Past trauma creates sensory disruption and protective guarding. A patient's physical history physically alters their nervous system's current reality, so restoring scar mobility is absolutely critical to clearing up that sensory highway.
Section 5. Why aggressive therapy fails. Safety over aggression.
We really need a paradigm shift here. For years, we've all heard no pain, no gain, right? Well, aggressive, painful therapy actually overloads the system. It cranks up the threat response, leads right to physical guarding, and it actually delays recovery. The alternative is safe, gradual exposure.
Safe movement restores confidence, it respects the nervous system, and it yields way better outcomes. Movement should be safe, never forced.
And remember, any tools we use, whether that's taping, wedges, or manual work, are just tools. Their purpose is to guide sensory input, support alignment, and help natural movement happen. We should never use them to aggressively force a mechanical change. We use tools to reduce threat, not to add to it.
Finally, Section 6, treating the whole system, holistic healing.
The body works as one entirely connected system. Because the nervous system is global, a local pain is often influenced by global connections. So a restriction proximally, like up in the shoulder or trunk, can heavily influence pain all the way down in the hand. We always have to look at the big picture. And here's a really surprising fact. The cranial nerves drive incredibly powerful sensory processing. The face and jaw have an exceptionally high density of receptors, so treating the face can actually change pain outcomes in totally different parts of the body. Crazy, right?
If you take away just one single thing from this entire framework, make it this. Treat the system, not just the diagnosis. A localized diagnosis simply doesn't tell the full story of how a unique person's nervous system is reacting. Every patient presents differently, which means we have to assess all the layers: skin, nerves, alignment, movement. Treatment literally has to be individualized.
So here is the actionable game plan. Step 1, we reduce the threat perception in the brain. Step 2, we modulate that sensory input using safe movement, space, and skin mobility. Step 3, this naturally allows the body to restore its function. And step 4, we achieve the ultimate goal, which is improving lives.
I want to leave you with this. Is your current treatment targeting the diagnosis or the whole person? Keep that provocative question in mind the next time you experience or treat physical pain. Are you just attacking a localized symptom and causing more alarm, or are you working with the entire nervous system to create a safe environment for healing? Thank you so much for joining me for this explainer. Keep learning, keep questioning, and we'll see you next time.